Welcome back, everyone. Today, we're diving into something every EMT knows and loves, or maybe loves to hate sometimes, basic life support. I've got this chapter from emergency care and transportation of the sick and injured here, and some slides, too. So I'm thinking a good old-fashioned CPR refresher is in order.
Sounds good to me. It's actually incredible how much emphasis they put on reviewing and refining these
Hmm.
guidelines. It really goes to show how crucial it is to have the most up-to-date knowledge when you're dealing with life or death situations.
Oh, absolutely. It's always changing, right? Like just the other day, I was reading this case about someone collapsing in a park. Luckily, somebody saw and immediately called 911. And get this, the caller knew CPR and started compressions right there on the spot.
See, that's a perfect example of the chain of survival in action. Those steps the American Heart Association talks about to maximize survival chances during cardiac arrest. That quick recognition and activation of emergency response, that's the first link right there. Then those immediate compressions, like in your example, those are absolutely crucial for buying time before EMS arrives.
Seriously, it's amazing how those compressions can sometimes be the only thing standing between life and death. And speaking of which, we all know those ABCs of BLS, right? Well, get ready for a little shift because we're talking CAB now, putting compressions front and center.
Exactly. When it comes to cardiac arrest, getting that blood flowing as fast as possible is the name of the game. We're talking chest compressions right away, that C in CAB. Because think about it, without a constant supply of oxygen, permanent brain damage can start in just minutes.
Time is definitely not your friend in those situations. And while we're on the topic of speed and efficiency, we have got to talk about AEDs. They're not just for adults these days.
You're absolutely right. We use them on children, too. And you'd be surprised how many people are caught off guard by that. Of course, there are modifications for kids, pediatric pads, dose adjustments, and even where we place the pads changes depending on the child's size.
It really makes you realize that knowing BLS is one thing, but understanding those little nuances for different ages, that's where it really counts. And, another thing that trips people up is thinking that you can do CPR effectively anywhere, like on a soft bed or even in a car. But it's not that simple, is it?
Yeah, I've heard that one too. People don't always realize how important a firm, flat surface is for effective compressions. You really need that solid base to push against and generate the right amount of force. And let's not forget about having enough space for two rescuers if you need them.
That makes perfect sense. So let's break down those chest compressions for a second. After all, those are the heart of CPR, right? And it's not just about pushing on the chest, it's about mimicking the heart's pumping action.
Exactly. It's about applying that rhythmic pressure and release on the lower half of the sternum. Each compression is helping to circulate blood to those vital organs. And just as important as the compression itself is that moment of full recoil you allow the chest to have between compressions. That pause, that's what lets the heart refill with blood before the next compression.
And let's not forget about hand placement either. I remember learning that using the wrong technique can actually do more harm than good.
Oh, absolutely. You've got to be mindful of the potential complications like rib fractures. All right, so we've covered the chest. Now let's move on to opening the airway. I'm sure you remember the head tilt chin lift maneuver, the classic, right? But have you ever thought about when we'd use the jaw thrust instead?
That's the one we use when we suspect a spinal injury, isn't it? I remember learning that.
Bingo. It's all about adapting to the specific situation at hand, taking those potential injuries into account. Now, let's say our patient starts breathing again on their own and they regain consciousness. What's our next move?
Well, we want to make sure they maintain that open airway, right? That's where the recovery position comes in, doesn't it?
Exactly. Such a simple change in positioning, but it can literally be a lifesaver. It helps maintain that clear airway, gives any vomit a chance to drain if needed, and reduces the risk of choking.
Speaking of things that can go wrong, I remember the materials really emphasize that risk of gastric distension during rescue breathing.
Oh, that's a big one. We definitely don't want to be forcing air into the stomach instead of the lungs. That can lead to some pretty serious problems. So slow and gentle breaths are key here. And always have that suction unit ready just in case.
Now, when it comes to actually performing CPR, there are those two main scenarios, one rescuer and two rescuer. What are the benefits of having that extra set of hands?
Well, picture this. You're the only one around, and every second counts. One rescuer CPR lets you jump right in and start providing aid immediately. But if you've got two rescuers, it means higher quality compressions and less fatigue for everyone involved. It's always best to have that second rescuer whenever you can.
It's like a tag team match where you're both fighting to keep that lifeline going. This is where things get even more interesting when we're talking about pediatric patients. Their little bodies react so differently, don't they?
Absolutely. With adults, you're usually dealing with a cardiac issue that leads to arrest. But with kids, respiratory arrest often comes first, making the airway and breathing your top priorities.
That makes sense when you think about how much smaller their airways are and how much more prone to obstruction they are.
Exactly. Kids are always exploring, which unfortunately means all sorts of opportunities for airway issues. Choking on objects, infections like croup, even things like near-drowning experiences. All of these can lead to respiratory distress, meaning a different approach to BLS is required. Those differences really impact how we approach pediatric BLS, wouldn't you say?
Oh, absolutely. Everything changes when you're dealing with those tiny chests and little lungs. I remember thinking it was fascinating in my training how we have to adjust everything, like even just checking a pulse or doing compressions. We can't approach it the same way we would with an adult.
It's true. Imagine the precision that's required. We're talking about using just 2 fingers for chest compressions on an infant. The amount of attention to detail is incredible. And if you've got 2 rescuers working on an infant, we switch to that 2 thumb encircling hands technique. It's all about providing just the right amount of pressure for that little heart.
It's like this carefully choreographed dance where every movement is adapted to the size of the patient. And even for older kids, we might use one or both hands for compressions, depending on the child's size and the rescuer's hand size.
Precisely. You're always assessing and adjusting, adapting your technique to whatever the situation demands. And speaking of adapting, let's not forget about airway management for kids. Something as simple as placing a wedge under their upper chest and shoulders can make a huge difference in maintaining an open airway.
It's amazing how these subtle little changes can have such a big impact. Now, another thing that really jumped out at me in the material was how often children end up choking. It's unfortunately quite common, and it can be such a scary experience for everyone involved.
It definitely is, and having that quick, precise response is so important. With a conscious child who's choking, the Heimlich maneuver is still our go-to, but with less force than we'd use on an adult.
Makes sense. You want to avoid causing any unnecessary injuries. But what happens if the child becomes unresponsive? Those must be some of the most intense moments for an EMT.
You're right, staying calm and acting quickly is crucial in those situations. For an unresponsive child who's older than 1 year and has an airway obstruction, we actually treat them much like we would an adult. But for a responsive infant, we use a combination of back blows and chest thrusts to try and get that object dislodged.
It's really fascinating how each age group and level of responsiveness requires a slightly different approach. And the source material emphasized that even if the child is breathing, we'd still put them in the recovery position unless we suspect a spinal injury.
Absolutely, we want to make sure the airway stays clear. And speaking of airway management, don't forget, those techniques often need modifications for children too.
So much to keep track of. This deep dive is really driving home the complexity and the nuance of CPR. We've been talking a lot about children, but what about those breaths during pediatric CPR? The ratio of compressions to breaths is different than with adults, right?
That's right. You've got a good memory. If the child has a pulse but isn't breathing, we open the airway and give 1 breath every 2 to 3 seconds. But if there's no pulse, we shift gears to a rhythm of 30 chest compressions, followed by 2 rescue breaths.
It's amazing how these small adjustments can have such a significant impact on CPR effectiveness. Now, on a more somber note, when do we make that difficult call to stop CPR? When do we know it's time?
That's a tough one, but it's a reality of the job, isn't it? Remember, CPR is about buying time. It's not usually a cure in itself. We're that bridge to more advanced medical care. So the best case scenario, the patient starts breathing and regains a pulse, and we can stop CPR.
That's the outcome we all hope for.
Absolutely.
Yeah.
But we might also stop if someone with the same or higher medical training arrives and can take over, like paramedics or a doctor. And sometimes, honestly, it comes down to our own limitations as rescuers. If you're completely exhausted and you're physically unable to continue those effective compressions, it's okay to stop. That's another reason why having that second rescuer whenever possible is so crucial.
It's like having a teammate to share the load and make sure those compressions stay consistent and effective.
Exactly. And then, of course, there are other situations where we wouldn't start CPR in the first place.
Like if the scene is unsafe, right?
Exactly. We never want you to put yourself in harm's way. And sadly, sometimes we're faced with those unmistakable signs of death. Things like rigor mortis, dependent lividity, decomposition. Those are clear indicators that resuscitation just isn't possible.
What about those situations where the extent of the injuries is just, beyond our help?
You're talking about non-survivable injuries, the kind of catastrophic trauma that's just incompatible with life. In those heartbreaking cases, CPR wouldn't be initiated.
Okay, shifting gears back to airway obstruction for a moment. Let's talk about removing a foreign body airway obstruction in adults. We touched on children earlier, but for adults, the Heimlich maneuver or abdominal thrusts, those are still our go-to for someone who's responsive and choking, right?
You got it. We're trying to create that force, that artificial cough,
Yeah.
to expel the object.
And if the person is pregnant or obese, we switch to chest thrusts, correct?
That's exactly right. It
Yeah.
all comes back to adapting our technique to the individual's physical needs.
Yeah.
Now, let's imagine you're with a responsive adult who's choking, and suddenly they become unresponsive. What's the protocol?
Okay, so if I remember this correctly, the first thing we do is get them safely onto the ground and make sure someone calls for help, or call ourselves if we're alone. Then we immediately start chest compressions, 30 of them, even before we check for a pulse.
You got it. Dislodging that object is our top priority. Then we open the airway, check the mouth for anything we can easily remove, and try to ventilate. If we don't see anything or we can't get it out, we go right back to chest compressions. And we just repeat that cycle until that airway is clear or help arrives.
And for an unresponsive infant, it's the same idea, right? Chest compressions, airway check, object removal if possible, and back to compressions.
Exactly. It's all about that continuous loop of actions, trying to dislodge the obstruction and get them breathing again.
It's quite a lot to take in. This deep dive has really given me a newfound appreciation for the complexity of CPR.
I agree. And we've really just scratched the surface here. There are even more specialized situations to consider, like dealing with an opioid overdose or even cardiac arrest during pregnancy.
You're right, the source material touched on those scenarios too. It's amazing how adaptable our approach needs to be, like with opioid overdoses. What are our priorities beyond just BLS?
Well, think about it. An opioid overdose is all about counteracting the effects of that drug, right?
Mm.
So beyond the basics of BLS, we might administer naloxone, which is more commonly known as Narcan. It's a medication that can reverse the overdose and help get the person breathing again, a real lifesaver in those situations.
And with pregnant patients, it's not just one life we're dealing with anymore, it's two. I remember learning about aortocaval compression, where the uterus puts pressure on those major blood vessels.
Yeah, aortocaval compression is a big one. If she's conscious and we see symptoms, we'd position her on her left side to take the pressure off those blood vessels. But think about this in a cardiac arrest situation, especially if the uterus is large enough to cause compression. We'd actually manually displace the uterus to the left.
Wow, that's one of those procedures that really highlights the unique challenges of dealing with pregnant patients, doesn't it? You know, we've spent a lot of time on the technical aspects of BLS here, the how-to and the step-by-step, but the source material really emphasized the emotional side of things too, especially for the family members. It's a good reminder that BLS isn't just about the physical act of resuscitation, it's also about providing compassionate care throughout the entire experience.
Absolutely. Families often go through this whirlwind of emotions, shock, fear, disbelief, you name it. And the way we interact with them can really make a difference.
The source material had some really helpful tips on providing support. What were some of the key takeaways for you?
Well, for me, it really comes down to communication. Having that clear, empathetic communication with the family throughout the whole process. It's crucial to have one provider designated as the point person to communicate with the family. That way they have one consistent source of information, and they're not getting different things from different people. And using clear language, leaving out the medical jargon, that makes a world of difference when you have a family trying to process what's happening.
It's about meeting them where they are emotionally and helping them through it all. And what about after the resuscitation attempt, no matter what the outcome? Those moments must be so difficult.
They are. And finding a quiet place to speak with the family after everything is settled down, that's essential. Even if you've been interacting with the family the whole time, make sure you introduce yourself. And never underestimate the power of using the patient's name. It shows respect and acknowledges the individual at the heart of it all.
Those small gestures can mean so much in those overwhelming moments.
Absolutely. And as EMTs, we need to be ready for a whole range of emotional responses. Staying calm, offering reassurance, using a gentle tone of voice, and even appropriate physical touch can help create that safe space for these difficult conversations.
One thing that really stuck with me was the reminder to be mindful of any children who are present. They're grieving too, and their needs are just as important as the adults.
So true. It's easy to overlook the little ones in those situations, but how they understand and process what's happening is just as important.
Before we wrap things up, let's go back to something we talked about earlier, and that's the importance of ongoing training. The source material was very clear about this. Our CPR skills can get rusty over time, even for us experienced EMTs. It's about keeping those skills sharp and staying current.
It's like anything else. If you don't use it, you lose it, right?
Okay.
That regular training, it's what keeps our skills fresh, and it's how we stay on top of the latest guidelines and techniques.
And there's so many different ways to train these days. We've got the classic mannequin-based sessions, video-based learning, even computer modules that combine theory with simulated practice.
And, we have a responsibility to advocate for this type of training, not just for ourselves, but for the public, too. Imagine the impact it could have if more people in our communities knew how to perform CPR.
It's a powerful thought. Equipping our friends, family, neighbors with this life-saving skill, it could mean the difference between life and death in those critical moments before EMS arrives. Well, that about wraps up our deep dive into basic life support. And let me tell you, we covered a lot of ground. From the evolution of BLS to those nuances of pediatric CPR, all the way to the importance of compassionate care.
It's been quite a journey. And if there's one thing I hope our listeners take away from this, is that BLS goes beyond just memorizing a set of protocols. It's about constantly learning, adapting to each unique situation, and approaching every patient and their loved ones with empathy and the utmost respect.
Well said. And to all our listeners out there, we'll leave you with this. When those sirens fade and the lights disappear, it's that human connection, the knowledge shared, and the courage to act that truly makes all the difference. Take a CPR course, refresh your skills, or even just talk to your loved ones about being prepared. You never know when you might be someone's lifeline.